Thank you. I haven't even done anything yet, but thank you. So I want this panel, I think I really appreciated the last one. I thought that this conversation it's going exactly the way kind of we dreamed it would, in the sense that we've got voices from so many different perspectives, but about something that's important to literally everyone in the room. And so I think that's really what I know will happen here in this panel as well. This panel, we're going to focus a bit more on gender equity. I think there's two ways to think about that. One is ensuring that women are included in the structural transformation, the future of work, automation, AI. That there's gender equity in who wins, through that process. But I think there's a flip side to that as well, which is to say that are we doing everything we can to accelerate that structural transformation, that growth, and so on, by actually making available to firms this huge population of half the population that is capable and willing to work, and so on and so forth. And so that can be this really interesting challenge to say, we could be potentially winning a lot faster if everyone had access, or if firms had access to everyone. And so I want to kind of use that to set the stage here. I think there's a lot of challenges with respect to that. We're going to talk about, how do we get women in who seem to not be able to get in at all? How do we skill those women to make sure that they've got everything, the exact same platform or foundation as any man or anyone else at any level of class has to advance? How do we retain them? And I think one particular thing that is interesting to me and become a key challenge is that even where we see women participating heavily, there seems to be segregation in what they do, what they seem to think they can do, or what firms seem to think they can do or want to do. So how do we break that both horizontal segregation and that kind of vertical advancement issue? So I'm excited to get into a lot of this, and I want to just introduce our esteemed panel, because I think that this is exactly a set of experts that can take this conversation forward. To my left here, we have Claudia Martinez, currently serves as the lead economist at the research department at the Inter-American Development Bank, and co-leads the Gender Lab, which now GBL is very familiar with, fortunately. She's a prominent economist from Chile, who holds the distinction of being the first woman to be appointed as a full professor at the Institute of Economics at Universidad Católica de Chile. As an affiliate of the JPAL, Claudia has conducted extensive research on various topics, including micro-entrepreneurship, migration, the inclusion of people with disabilities, and, importantly for today, female labor force participation. Her research has contributed significantly to the field of economics and public policy, no doubt. So I'm very excited to hear from her. To her left, we have Gilles, who is the strategic partnership specialist at the UN Population Fund, where his work focuses on exploring, expanding, and managing partnerships with the corporate sector, critical to our conversation today. Gilles has more than 11 years of experience in international development, with a focus on gender-based violence, child protection, and sexual and reproductive health, which of course we're going to get into, end up being key challenges to kind of addressing gender equity and in this kind of advancement. He's worked in UN agencies and international NGOs, both in the field and at the global level. He has a background in innovation, partnerships, program design, and monitoring and evaluation. And lastly, to the left, we have David Wofford, who's the Senior Director of Private Sector Strategy and Engagement for the UN Foundation's Universal Access Project. He leads its private sector action on Women's Health and Empowerment Initiative, which promotes corporate action and accountability for effective workplace health policies and practices. He also helps manage the Resilience Fund for Women in Global Value Chains, a corporate pooled fund which invests in women-led organizations. For 20 years, he has led health and well-being projects and business case research, importantly, given much of what we're talking about today, in South and Southeast Asia, East and West Sub-Saharan Africa, and the Caribbean. So I think these are all a myriad of perspectives that will be really interesting to draw on. Let's just have a quick round of applause. Oh, I see. My co-author has reminded me that I've not introduced myself. I'm Anant Nyshadham. I thought I was famous, but no. I'm Anant Nyshadham. I'm a development economist on faculty at the University of Michigan. But I'm also, maybe most importantly for today, a co-founder of Good Business Lab and organizer of this conference. I've actually devoted my entire research career to kind of the questions that we're talking about here, and I have not looked back. So I'm glad to see so many other powerful and important people kind of joining along. I think just to start, just to get a foundation of kind of what we're going to talk about and hear a bit from everybody to set the tone, I'd like to kind of draw on each of your distinct experiences to hear about what you think are the most salient challenges to women in the workplace over the last 10 years. And I guess as a counterpart to that, what do we think are the most interesting opportunities to address these challenges in the next 10 years? Maybe we can start with Claudia and move on.
Sure. So in the last 10 years, I'll say that COVID showed the need of flexibility on one hand, and the need and the availability to do a flexible job and work from home. But on the other hand, it also showed the need for frontline workers and like the high need of frontline work that have to be on the place, and also showed like the effects of the school closure and disruption, and like the difficulties of care and work at the same time. So in the next 10 years, like as was said before, like we're really, I think, in a change of era. So it's very difficult to know what's going to happen. On one hand, I would say that there's going to be an increase in care economy just because the population is aging, and that's typically more like a woman's job. In the case of the region in Latin America, about like 11% of women work as domestic workers, for example. And that's something that is going to, we could imagine that it's going to be increasing. On the other hand, there's going to be an increase of high cognitive, advanced cognitive skills demand. And those are going to be like a very different type of jobs. Again, like they're going to be hopefully flexible but highly demanded. And we're going to see like the typical difficulties that women have on getting up into the ladders if the demands are too high and not compatible with the care that social norms say that we should be doing. And at the same time, there's going to be a decrease in repetitive work that is mostly done by women. So that's also going to decrease the demand for the job. It's very difficult to predict what's going to happen with the AI. Like if one take like a positive view, we can think that AI can help people to help people. Like, for example, they can improve productivity and in education or in health. On the other hand, it can replace people. So that can have an effect on women's job, and so it's very difficult to understand. But at the same time, I think like AI is not going to replace some things. Like people need motivation, people need other people to finish things, people need other people for accountability, and that might be soft skills that are more developing or more typically by social norms. Developed by women, and therefore that also can give us an angle. So, but I think there are like several angles that we can take to think what's going to happen.
That was really interesting. I think there's quite a few things there that spur ideas in my own mind and stuff that we're trying to work on. Technology brings about these ideas of like, how can the platform economy or the gig economy help to formalize to some degree or professionalize some jobs like domestic work that women do and solve their search frictions and a bunch of other issues in that space. But then there's this also like, automation, AI is still a boogeyman, that might get rid of certain jobs and maybe even disproportionately jobs that women are taking up. How can we like be careful about that and try to use it, potentially to complement their work or set up women to kind of, not break out of roles that are traditionally.
And typically like in the platform jobs, what we see is are mostly taken by men. And there's still like a wage gap there because of how much women can actually work there.
Yeah, very interesting. Gilles, what do you think about major challenges we've seen in the last 10 years and or opportunities we see in the next 10.
Yeah, thanks, Anant. Just a couple of words about UNFPA. So we are the UN Agency for Sexual and Reproductive Health. So my focus is really going to be on how women's health issues and sexual and reproductive health in particular are represented in the corporate sector, how they actioned in the workplace, and what we've continued to see in the past 10 years that it's been the case before. It's that mostly these issues are invisible. They're not really included in corporate policies, and we see very little action on those topics in the workplace setting. We've conducted a research recently about ESG standards and frameworks to see to what extent women's health is included as an action on which corporates report. And unsurprisingly, most of the topics related to sexual and reproductive health are absent of those frameworks. So we talk here about menstrual health, maternal health, menopause, parental leave, so really quite a wide variety of topics. And we see that there are a few strides. We track better women in leadership positions. Parental leave also becomes more and more of a topic, but sexual and reproductive health in general is still fairly absent. I think what we see in the pace of change also, we estimate that if we are with the same pace now, it will take 150 years to reach gender equality. So for the UN, it's really essential to work with the private sector to accelerate this and to make really strides that create new opportunities for women. In terms of the change in the next 10 years, I think we see a push for consumers that really look at stances of corporates in terms of those issues. The reversal of Roe v. Wade in the US was a good example of how consumers were looking at corporates taking stands on issues that they shied away before. That were considered as too controversial, too difficult for them to really position themselves, but consumers more and more pushing the corporate sector to be active. And employees as well, on their side, looking at choosing employers that prioritize well-being, put in place policies that also allocate more space for health issues to be prioritized. So our argument is really to make it part of the bottom line, make it part of the fabric of a corporate on integrating these topics and really considering sexual and reproductive health not as a social investment, but really part of the operations that they run on a daily basis.
Thanks, that's really great. I mean, I think that makes a lot of sense. It certainly resonates with me, but I think it's so interesting. It's one chief example, especially with respect to gender equity, of this way in which, firms have this traditional notion that these are personal problems, they're not work problems, and yet then on saying that out of the one side of their mouth and on the other side of their mouth complaining about how they can't get women in the door, women aren't interested in their jobs and so on and so forth. It's this kind of like really strange blind spot to saying that, this many aspects of this and the benefits we provide and the way we interact with our workers, the way we support them, are kind of designed to meet those needs of men, but they have total blind spots with respect to women. And so there's some fundamental kind of restructuring. David, what do you have to add on this?
Yeah, and I'm with the UN Foundation, so if most of you may know this, but we're not a UN agency. We are a US NGO that supports the UN, supports advancing sustainable development goals, and my part of the UN Foundation Universal Access Project works very closely with UNFPA. On the governmental side, tries to advance government policies to support for better reproductive health rights, but also funding for UNFPA and family planning. So we partner very closely with Gilles and his team. But I think for us, in one sense, the last 10 years are same as it ever was. GBV, dehumanization. We can go through lists, the way contracts are set up that are unfair and put pressure on suppliers. We can go through a long list of that. I will just jump on the COVID point, which is, you saw all these terrible things, and we saw it had disproportionate harm to women. They were laid off first. There's much more violence. There are rights, and we know that family, unwanted pregnancies and other things happen. The access to reproductive health and general health services, all this sort of just elevated, all these issues that have always been there, but we now saw it starkly. And I think the thing for us when we think about health and reproductive health is not that that's the only solution to all the world's problems, but we know that health is a fundamental issue for the workforce and women in the workforce. And, you know, Claudia Golden's research was referenced here by Esther. I didn't hear this, so excuse me if I'm wrong, but she didn't mention family planning. And her research showed that family planning was fundamental to women in the workforce. And if you talk about business, except for Shahi, because I enjoy talking with Anant all the time, or from time to time, about these issues, business doesn't want to talk about this fundamental fact that if women are going to join the workforce, it's not just about getting board representation and equal pay and other things, board representation that's really, really important, but also for people at the bottom of the economic ladder, women, the control of fertility is fundamental to their ability to join, stay, and thrive in the workforce and advance. So this does not mean that this is a business role alone. These are hugely complex social issues, norms and other things affected in every context is different. But to not recognize that as a fundamental part of ability to be in the workforce, and research by Tufts and others, it helps on agency if you deal with health. People have more sense of agency. One of the things, and you can talk to Laura Babbitt with Tufts if I say anything wrong here, but one of the interesting things about health was one of the studies they did showed that there was greater sense of happiness and mental health well-being if they had more control of their fertility is one of the factors of sense of agency. So I may not have said that correctly exactly, but health has fundamental value, and the question is not the business solves that problem, but how do you make that fundamental to how you operate a business, not as just one-off programs. So I'll stop there.
I think that's really great. I appreciate that. I think it has this kind of holistic health has been one of our pillars at GBL, one of our 4 main areas of focus since the very beginning, and that can be, of course, we're working together with many of you on sexual and reproductive health kinds of projects, and so that's going to be critical to gender equity. But we've seen this even in nutrient deficiencies, which often are more intensively felt amongst women, in vision correction, which often carries around a stigma and norms that women don't want to have, and so on and so forth. There's so many ways. Mental health, which often is kind of ignored, around the psychological safety, concerns around depression and not meeting your family's demands on your time and so on and so forth. That again can be so uniquely, intensively felt in different ways. So I think that's really fascinating. I want to use this discussion and even David, what you said about Claudia Golden's work and recent Nobel, which I think brings this discussion front and center, about we know what the challenges are, and we've known them for some time to some degree. Right. Her work has shown what we've learned from the developed world, not too long ago. So what do we think are some strategies we're seeing, innovations, insights that we can either draw from the experience of the developed world, or maybe we need to contextualize new things that we're seeing that we might need to do in the experience of LMICs that isn't something we've seen in the developed world. Gilles, what do you have? I know your work has kind of addressed some of this. So what do you think?
Yeah, so I think on the business case, and thanks, David, for putting family planning really at the center, we know that still today, half of the pregnancies every year are unintended. So that's 121 million pregnancies that are completely unplanned. And family planning is really a lever to accelerate economic growth. So the business case is there. We know that investing in family planning really benefits not only just the women and the family and the community, but entire economies as well. So we see it as a really priority investment. We try also to bring that perspective to the level of the company. And one of the initiatives and tools that we've launched with GBL and the support of the UN Foundation is that return on investment tool that we're piloting with different companies. It takes a range of sexual and reproductive health intervention in the workplace, whether it's peer education, whether it's training of managers, whether it's setting up service points in factories themselves, menstrual health and hygiene interventions. And it allows them to see the kind of impact their investment will generate in terms of retention of the staff, in terms of productivity, in terms of absenteeism. The model is based on the latest evidence, and the more we populate it with the experience of our corporate partners, the more predictive it will become. But it really shows why, again, it's not just a good investment or it's not the right thing to do, but how it benefits directly into day-to-day operations and the business itself. So we've seen, for example, that if you put in place a menstrual health program and access to products within the workplace, you can result at almost a 10% increase in productivity of your woman worker. So that's really the kind of tool and business case that we try to bring to the company itself. I think for the sector, we're looking at the rise of sustainability reporting as another way of pushing this topic, of providing also concrete ways to companies on implementing women's health interventions, and to ensure that these metrics on women's health are included in those ESG frameworks. For the moment, again, mostly silent on these. And we know that what gets measured by company gets done more. So one of our priorities is to make sure that we include in ESG frameworks issues around gender equality, but more specifically sexual and reproductive health as well.
That's great. Thank you so much. And of course, I really appreciate your highlighting what we're working together and even the ideas that that your team kind of brought to us to say, hey, let's turn this into a tool. Let's make it accessible. Let's keep building it and kind of generalizing it. It's something that we're really excited about. And we think there's just the beginning. I will say one thing that I think, David, you brought this up. And of course, health, women's health issues definitely are bigger than fertility. But fertility is so central. It's interesting, just as like, a student of economic history or history of economics, I would say, like fertility and growth have been linked for a really long time. There's a classic like Malthusian idea that like, in an agrarian society, we need more fertility. And then this is clearly bent and gone the other way, but we've kind of forgotten how central it is, that half the population, and sometimes, even men might be affected, but like, at least half the population, their productivity is perfectly linked to the idea of like whether they can control their personal lives. Maybe most in this very critical way. David, what other insights, innovations, and so on have you seen?
Yeah, I mean, I think one thing just to say on research is not just Claudia Golden, but when I first joined my first project funded by USAID, the whole birth spacing research across the world that happened in MATLAB in Bangladesh showed that women and families that had control of their fertility and spaced their children by 3 years, less maternal mortality and morbidity, healthier babies, healthier other children, better education, richer families. It's clear it's not about, family planning has had a dark history all around the world and certainly part of South Asia, right? So this is a very complicated thing that you have to be careful how to talk about it. But when it's talking about empowerment and control, it's not about not having children. It's about how you have them and being able to make the choice and the power of people to make their own choice. But we know that spacing has fundamental economic, family, health, and other values. I mean, but the way we think about it isn't just saying, oh, let's talk about family planning, but how do you practically change how you think about health at the workforce? Now, one of the innovations that I'd love to see, we've been talking about this for a while, which is there's a historical divide in health in this world, right? In the 20s, 10s, labor unions and others fought for occupational health and safety because of dramatic, terrible things that happened to workers and have continued to happen in various places to ensure the health and safety, and more conventions happened over time. Then you have the public health structure, which is separate. So labor health is handled in countries by departments of labor or ministries of labor, and public health is by ministries of health. These two don't talk. They're seen as different systems and are disconnected. And if you think about the problem of how I think companies think about health as a labor right and a tick-the-box kind of compliance piece. Now, that makes absolutely no sense. When a worker walks in the door of your factory, they don't lose their fundamental human right to health. And so this isn't saying that you should turn a factory into a health care center, but the question is, what is the role, legitimate role within their business standing to think about health, how workers get access to it? What are the policies and practices? You may have a PACE program which has a health component to it. It's not just about that, but there is one. Or it may be any number of ways. It may be partnering with with the government, and we've had with Tufts and Swasti, how business can help workers get their benefits, that even though they may have them already, they can't access them. We know that women workers, if they're working all day and they have family duties, public health services aren't available to them, certainly reproductive health. So thinking about how you use your health differently and the structures that change is really important. I would say one other thing, and just as a gender equality piece here, every manufacturing, agricultural enterprise of some size has a clinic of some kind and often staffed by nurses. Now they sit around often on their phones when nothing's happening. And this is the old model that you wait for people to come in and it's check the box, they're there to put Band-Aids and send people to the hospital and give aspirin and things like that. You could innovate to think how you use a fundamental group of people you're already funding. Everyone says the business case for health, and I say, what's a business case for letting talented nurses sit around and do almost nothing all day? Why aren't they, unlike a clinic, out there walking the halls, getting to know workers, doing the soft skills, things like that? There are many ways they can do it, and then you create a connection between the public and private health system and use your existing staff better. So I'll stop there, sorry.
No, that's great. Thank you. I think you brought up a lot of topics that are close to my heart, and I could kind of go on tangents where I think this is definitely tends to be a sensitive issue to talk about, and a sensitive issue for firms to want to engage in, and even more sensitive in many LMICs. And yet somehow the sensitivity makes us want to ignore it, rather than leaning into the idea that this is like a fundamental relationship and a fundamental thing. Let's go deal with the sensitivities. And I think that that's actually central to a lot of what GBL has found as a frustration, but also an opportunity in development work, partnering with firms. There's this general, it's almost seen as dirty to say, oh, we want to partner with the for-profit sector to do development work. Right. No, that's a public sector thing. That's an NGO thing. That's but it doesn't have to be that industrialization looks the way we know it has in the past.
Right.
Let's go address exactly those challenges. But let's not pretend that we don't know what the path of development looks like. It's looked the same in every country in every corner of the world, for hundreds of years. So I think there's knowing what's fundamental and challenging what can be challenged. The actual issues, I think, is a really interesting point, and it really applies really well, I think, to these topics here. So I just want to now get into a little bit of specifics. I want to work on think about labor force participation. So I think there's kind of a couple of different elements to this. One is getting women into the workforce. Two is retaining them. Three is advancing them. We're running a little bit short on time, so I want to maybe combine that. We have questions on those, but I want to give opportunities to combine those a little bit. Claudia, can we kind of go over what you have seen as strategies that can work in maybe each of those dimensions?
So I think we should first think that different levels of issues. So I would think that there's a first generation level of issues, which is violence in the work, in the firms, and exclusion. Laws that might exclude women, violence, and make it difficult or very dangerous to go and work. So I think those are the first layers that we should think about. And then we have access, and then we have how to get a woman to get up into the ladder. So regarding access, I think care, of course, it's care not only for childcare, but also for elders as well. And I think care by itself, but also urgent care, that sometimes nothing works, and you need someone to actually do the care at that point. I remember at some point I had to teach with my baby because I didn't have anyone to care for my child, and I just had to do it. And yeah, it was funny. Then we have, of course, breastfeeding, paternal leave, which should be paternal, not maternal. It should be for both parents, and it should be transferred from one to the other one, because you definitely don't want to make a woman more expensive to hire. Mentoring, role modeling. I think something that surprised me that there seems to be some evidence about is that the wording in advertisements seem to matter. So women tend not to apply to positions that say leadership or competitive. So be careful how to word your advertisement might attract or not attract women. Visibility of women in leadership roles, flexibility in work. And something that I didn't thought, but I was reading about is reproductive rights, of course, but also menopause. I think like if you wanna, like one thing that if you want to have women in leadership positions, you should be thinking that about around 40, 50 women get menopause, and some of them are getting out from the workplace. And I think that's something that we should be starting to talk about, and how to do accommodations for that. Well, of course, we don't, again, want to make women more expensive to hire or more risky, but at least we should start thinking about it. And I've been reading that like there are some cheap maybe things that firms should consider, for example, having fans in the desks, or having more or different type of clothing, or having the flexibility for women to be like near the air conditioner, or allowing more breaks can also help for that. That like they're small thing, but someone should be thinking about it.
So many, like, I feel like once you go down these avenues, there's so many new things to try, and so many, it's really fascinating.
Yeah.
So just because we're short on time, I wanted to hear for 1 second, but Gilles, if you, if you could think about the retention margin, and then maybe we can go to David and think about kind of the future of work and automation. But I'd love to hear what you think, what you've seen work and what we've learned.
So in trying to remove barriers to access to opportunities for women, we've launched our workplace program, and we work in different contexts to address the most pressing local needs. I think David mentioned, access on-site to clinics and strengthening the existing workers, healthcare workers in clinics to provide that counseling, support, education, and services. So in Indonesia, we work with H&M in different factory settings to provide that kind of support. In other contexts like Eastern Europe, we realize that the main challenge is the gender-responsive policies, taking into account the care responsibilities, the fact that that women still do unpaid care work 3 times more than men. So how do we change the job to accommodate this? But how do we change the norms as well to make sure that this is no longer the case? Parental leave is a huge part of this, and I have to do my own self-reflection. UNFPA changed the parental leave for men 2 years ago. It went from 15 days to 4 months. But again, how do we really challenge the norms that it's fine for a father to go back to work 2 or 3 days after having a new baby? So if we don't change these policies, then we don't change the social norms that also restrain access to women. The last point I'd like to bring up is the sexual harassment in the workplace. We know that though a lot more companies have policies around this and systems for reporting, most of the cases go unreported, 3 out of 4. And that is a big driver of women leaving positions, leaving the workplace, or being constrained in their achievement of promotions, for example. So this is a big thing to tackle as well.
Thank you. I really appreciate that. I think really a lot of important issues here. David, I know you have a lot to say on many of these kind of margins, but I'd like to direct your attention towards maybe this future of work we've been talking about, the rise of automation, and how you think that relates to this discussion about making sure, thinking about gender equity in the workplace.
Well, probably more people in this room know more about this than I do. I mean, I did see a recent study by it wasn't an RCT, but looking at some Bangladesh factories who wanted to do automation in factories during COVID, but didn't have the funds, and now they're looking at it. And the outlook was poor for women because the outlook has not been so great for just getting into supervisory positions. So are you going to get them into this? So this is a bleak time for all of us, and all sorts of stuff happening in the world, right? But there's not very hopeful right now unless industry and brands and others really come together to figure out ways to do it. And it's the sociological issues that were raised in earlier discussion are very serious in how you do it. But right now, I would guess in 10 years when automation comes on, you're going to see more and more men being in the leads in apparel, at least. Others. I don't have much more insight than that.
Yeah, no, I think but that's right. I think just to kind of summarize before we finish, or to give more food for thought, I think that's exactly right. I think on the underpinning here, the same stuff that says, look, we need to get more women in the workforce, but we also need to get them into different kinds of jobs, right? We need to rethink what we think. Why can't any job be a woman's job? And why can't a woman, advance to leadership? Let's change this notion that somehow women might not want to do that because it's more demanding, or because they have other concerns and they don't want to, stay late, and so on and so forth. Well, why does a manager have to stay late? Why can't we make a managerial role work for a woman? And I think I'll just finish with one thing that's come up before, and it was mentioned here also. This topic around women's health, around gender equity, can in so many contexts be talked about in the context of norms in so many of these LMICs. Right. And I don't doubt that the importance of norms is quite strong. But I think Esther brought up a great point that I certainly take seriously, which is that if I had to guess how much of these kind of labor force participation issues, advancement issues, and so on are really driven by norms, with zero evidence, I want to say that it's definitely not the majority, in the sense that norms we have seen can respond to opportunity, to access, to incentives. Now, we might want to also in parallel work on norms to accelerate these kind of work, right? But the norms alone are not going to change anything if the opportunities aren't there, and if girls don't think they can have these jobs, and women don't think they can be managers, and so on and so forth. So I think this panel has a lot to say in some sense about this kind of back and forth between norms. I will finish there though. Okay, and unfortunately we don't have time for question and answer here, but we do have time, in the breaks and so on to talk with you also. Thank you so much, and thanks to the panelists.